Hello NAVFAC Southeast, I'm Captain Mike Monreal, your commanding officer. There is nothing I value more than your health and safety. I want you all to stay safe while being vigilant in the risks we take to accomplish the mission. We have implemented actions to effect a distributed workforce, including teleworking, as we continue to support the fleet. With that, I know many of you have questions on using or requesting leave during the response to COVID-19, especially if you or a family member are not feeling well. I would like to review some scenarios that you might encounter and inform you on the actions you should take. You can continue to telework and report in every day to your immediate supervisor that you are online and working. However, if you feel as though an illness prevents you from performing your work, you should request and use sick leave. If you have to take time off to assist a sick family member or child at home, you will need to request and take leave during that time. If the family member is sick, you can request use of your personal sick or annual leave. You will need to determine if these supplies or errands are necessary to help take care of a sick family member. If so, you can use sick leave. If it is for personal use, you would need to request and use annual leave. Please note that all leave requests need to be made through your immediate supervisor. Remember, annual leave can be used if you do not have enough sick leave. If you are out of leave and become sick, you can request advanced sick leave. There is a process in place for these situations. If needed, please speak with your immediate supervisor about requesting advanced sick leave to get the paperwork started. Additionally, employees may be eligible for leave donations from other employees through the Voluntary Leave Transfer Program, or VLTP. Please note that this application process will require a note from a physician and can only be used once all leave is exhausted. For information and guidance through this process, you can reach out to our Labor and Employees Relations Office. During this pandemic, the command also has the authority to use a type of administrative leave called weather and safety leave. The supervisor determines whether the use of this type of leave is appropriate. An example of an authorized use of weather and safety leave during the COVID-19 situation includes an employee with chronic health conditions that cannot come to work and is not a telework participant. Under certain specific situations, the command can place employees in an administrative leave status. Keep in mind that this would be a rare occurrence and would be discussed with your immediate supervisor and submitted to the chain of command for approval. Weather and safety leave is not authorized for employees who are sick. Sick leave is the only authorized leave to be utilized for those employees experiencing symptoms from COVID-19 or another illness. If you have been tested for COVID-19 and waiting on the test results, you need to stay home until you receive the diagnosis from your healthcare provider, self-monitor for fever, cough, and difficulty breathing, and contact your supervisor. During this self-isolation time, employees can use sick or annual leave, or in certain situations, weather and safety leave may be authorized. Requests need to be submitted through your chain of command for approval. Make sure to keep your supervisor updated on your status. Many employees are working from home, but if you are planning on going into the office to work, you must complete the COVID-19 Screening questionnaire before you leave home. If you answer yes to any of the questions, you are directed to report it to your supervisor and follow the guidance provided in the questionnaire. We do not want anyone coming into the office to work who is currently sick, who has a temperature of 100 degrees Fahrenheit or higher, has traveled internationally in the past 14 days, has traveled outside the local area of 100 miles in the past 14 days, or who has been in close contact with someone who has tested positive for COVID-19. If you have traveled outside of your local area of 100 miles within the past 14 days, do not report to work and self-monitor for fever, cough, and difficulty breathing. If any of these symptoms occur, you will need to disclose that to your supervisor and contact your healthcare provider. And if you are not able to telework, your supervisor may grant weather and safety leave. For the safety of all our employees, we have put a copy of the COVID-19 screening questionnaire at the entrance to each of our facilities to ensure that anyone who is attempting to enter our facilities follows this guideline. This questionnaire is also available on Facebook and the NAVFAC Southeast app, located in the COVID-19 guidance section and on the NAVFAC Southeast web and portal pages. If you have other questions, please contact your immediate supervisor. Let's all continue to be patient and proactive in doing everything we can do to mitigate the effects of COVID-19 on our entire workforce, their families, and the local population. Stay safe, stay healthy.